Good afternoon. My name is Lisa Maxwell, and I'm a project guide with the Greenhouse Project. And on behalf of the Greenhouse Project, I want to thank you for attending today to listen and learn on the Greenhouse Peer Network. Today we have an exciting partnership to share with you, PACE and the Greenhouse Model. Can we go to the next slide? Thank you. We've titled this Opening the Doors of Accessibility. The Greenhouse Homes are now part of one of the most innovative healthcare programs in the country, and PACE stands for the Program for All-Inclusive Care for the Elderly. In March, 2 greenhouse homes opened as part of the Thome Rivertown Neighborhood, which is part of the program PACE of Southeast Michigan. They are the first homes to be part of the PACE program. And in today's webinar, our 2 guest panelists will help us understand PACE and how it aligns with the greenhouse values. We'll gain some insight into the Rivertown neighborhood and the Weinberg Green House homes, and explore the value of these homes from a clinical, financial, and social perspective. So without further ado, I'd like to welcome Lori Gonzalez and Ellen Byrne, and I'll have them both introduce themselves in a moment. But if you have any questions throughout the presentation, if you could please use the chat box, and we'll make sure to get to your questions before the end of the presentation today, because we have everybody on mute to reduce the background noise. So I'll turn this over to Lori. If you could please introduce yourself.
Sure. So hi, everyone. Good afternoon. Thank you so much for joining the webinar today. My name is Dr. Lori Gonzalez. I'm currently research faculty at the Claude Pepper Center at Florida State University. My current research focus is on both the quality of care and quality of life in community settings for older adults and also residential settings. And in particular, I've followed for several years both the program of all-inclusive care for the elderly and the greenhouse. So I'm very excited today to be a part of this, this webinar.
And hi, everyone. I'm Ellen Byrne. I'm the Senior Development Manager for Presbyterian Villages of Michigan. We are a senior living organization, nonprofit that serves all of Michigan. We have 30-plus locations throughout the state. I have just recently joined our facilities advancement team, our construction and building and growing portion of our company. While I was doing this project, though, I was actually the executive director of a CCRC campus also within our company. So this is a new role for me, but I'm thrilled to be joining you all today and telling you a little bit about what we've been doing.
So the first things I thought that I would do is just give everyone who may not have a lot of background information some points on PACE, and then I'd like to go through just a couple of points as to why I think that this partnership between PACE and the Greenhouse Project makes so much sense. And then finally, I'd like to give you all a couple of background information on some of the research on PACE and some of the studies. So first, regarding PACE, a little bit of background. So PACE was a program that was started back in 1973 in San Francisco. It was started because there was a community of Filipino, Chinese, and Italian Americans who had a different idea about how they wanted their loved ones, their elders, to be cared for. They didn't like this idea of, nursing home, facility type of care. That wasn't what, their cultures really believed in. And so what they did was they grouped together in the community, and a local public dentist actually ended up working with this group to develop ONLOC. And ONLOC stands for, it's Cantonese for Peaceful Happy Abode. And what ONLOC was the first community elder care program in San Francisco. And how it was developed was that elders would visit these day centers that would provide things like maybe a hot meal, different types of health services, whether it be a flu shot, and would also provide some respite for caregivers during the day. And so the elders would spend the day in this unlocked community care center and then would return home for the evening afterwards, after receiving this care. So it was a program that really gained a lot of popularity in San Francisco. And then in 1983, they applied to receive a waiver program from Medicare and Medicaid, where they would take on this risk-based capitation payment, which is basically a lump sum that they would receive from Medicare and Medicaid. And in return, Unlock would be responsible for the entire care of each individual enrollee. So every month, the Unlock would receive a Medicare Medicaid fixed payment based on a care plan that was developed when an enrollee originally came to the center, and they would receive the payment, and then Unlock would be responsible for the entire care of the elder. And the program was actually so successful that in 1986, Congress actually approved this waiver program for replication, not only in San Francisco, but throughout the country as well. And finally, we had in the Balanced Budget Act of 1997, PACE became a permanent provider and also a state Medicaid option. Advance, please. Okay, so what does PACE provide? So PACE provides a lot of different benefits. It's said to be so successful. PACE is so successful because it is this very comprehensive program. So the benefits under PACE, they include all of the Medicaid and Medicare services, and they also include any additional services that a provider might say that a particular elder needs. And so under PACE, you might receive the adult daycare, you might receive hospital care. PACE also pays for nursing home care, physical therapy, social services, and transportation. And again, this list that's up here is not exhaustive. There's also different types of, they might go to a PACE center and receive, meals or something like that. Oh, thank you. To be eligible for PACE, you must be at least 55 years old. You must also be certified to need a nursing home level of care. You have to reside near a PACE center. And the final requirement is that you also have to be able to safely live in the community. And the services that are provided by PACE, you can receive these services in an adult day health center. You can receive services in your home or also in residential facilities. Again, PACE is funded by, the PACE programs will receive this capitated lump sum payment for each enrollee based on their risk assessment from Medicare, Medicaid, and private pay. But let's say that someone is, not Medicaid eligible. So if you're only Medicare eligible, then you have to pay a small premium for Part D for your prescription drugs, and then you'd also have to pay for a monthly long-term care premium. If you're Medicaid eligible, you wouldn't have to pay for your monthly long-term care premium. So this lump sum payment, again, is Medicare, Medicaid, private pay. Although most of the beneficiaries who are enrolled in PACE, they're dually eligible for both Medicare and Medicaid. Another beneficiary characteristics is that most enrollees, they require help with 3 or more activities of daily living. They tend to be 80 years old, are living with 7.9 medical conditions, and half of the folks enrolled in PACE are also living in dementia. But again, they're living primarily safely in the community with dementia. So in other words, PACE is so neat and so successful because if you look at these beneficiary characteristics, it's taking care of folks who are largely on the lower socioeconomic status, but who also are frail elders. But it's allowing these folks to still remain in the community. So I think that that's really one of the great benefits of PACE. Here's a map that shows you the different states where PACE programs have been established. PACE currently has over 30,000 enrollees, and that comes out to about 116 different PACE programs throughout the U.S. And PACE operates in about 36 different states, with the notion that it's better for the well-being of seniors with chronic care needs and their families to be served in the community whenever possible. So what I thought was so neat, as I mentioned in the beginning of the webinar, since I've come to the Claude Pepper Center, the two tasks that I've really been working on have been looking at, what is the best provider of quality of care and quality of life in the community, and then what is the best in a residential setting. And I'd happened to come across both PACE being the best, in my opinion, with community, and then Greenhouse being the best residential setting. And so I was so incredibly excited when I heard that these two would be joining forces. And I really think that it's really neat because both of these programs, they honor elders' preferences to live in a residential setting. They also both provide this excellent level of quality of care and quality of life. And they really do provide innovative care regardless of this ability to pay. You don't have to be incredibly wealthy. As I mentioned with the PACE program, it serves largely dual eligible folks. So these are three primary reasons why I think that this is a really great partnership between the two. Some of the research findings on PACE, we always want to know, is this actually cost effective? It sounds really great. It's this comprehensive care. It keeps people out of, nursing homes and things like that. But does it actually work, and is it cost effective? So some of the scholarly research that I've seen shows that yes, it is actually cost effective. But initially, some of the studies are showing that the costs are higher, but the costs will actually level off over time. And so the reasons why the research literature is finding this is because initially it might be expensive to establish a PACE center if that's where the services are going to be provided. And then also figuring out what's the appropriate capitation rate based on the mix of elders that you have and their needs. But once you're able to figure out those two pieces, the costs level out over time. Other studies that I've seen have actually shown that there's cost savings relative to other forms of care. So for example, there were 3 different state assessments that I was looking at, and they found that the savings to Medicaid in those states were actually between 17% and 28% lower for PACE enrollees compared to a similar population living in the community or in a nursing home setting. So this is a cost-effective program. So the quality of care research literature. Studies show that the quality of care for PACE enrollees is ranked very highly, both by the enrollees and their families. That enrollment into PACE, it delays nursing home admission, and furthermore that folks are less likely to ever even need a nursing home level of care. So it really helps folks to remain in these community settings. They've also found that there's lower levels of depression and also less hospitalizations. In terms of the research on the quality of life and also the satisfaction with PACE, again, both PACE participants and their families really like this program. They have very high levels of satisfaction compared to alternative community care or nursing home care. Folks in the program, they report feeling safe, secure, that they are treated with respect, and that they also have good control over their decision-making with their care and with their life. Elders also report fewer worries and increased social interaction. But the one thing that the research did demonstrate in several different studies was that The enrollees weren't necessarily happy all the time when they had to give up their primary care physician that they had been using for years, and then they had to switch over and use the PACE physician. So that was one downside to it. But a lot of the other quality of life and satisfaction surveys really show a very high quality of care, and people like this program. So now I think I'll turn it over to Ellen for her section.
Sure. So Presbyterian Villages of Michigan, and you'll hear me refer it to PVM. Again, we've been around for about 70 years. Our primary presence is in the city of Detroit with senior housing. Most of that HUD and MISHDA tax credit housing. And so our board and our strategic planning committees way back in mid-2000s started talking about wanting to create an affordable CCRC in the city of Detroit. This is before Detroit started its resurgence in building and construction. It was really at the downturn of the housing market, but it was something that our folks had been talking about for a long time, wanting to be able to do this because it didn't exist. So that's where the idea was first launched. Although it wasn't launched on the river, and it wasn't part of Thome at that point. So it was originally part of our, if you can advance. It was part of our Brush Park neighborhood, our Brush Park senior living community. So our goals were that we wanted to obviously meet the needs of our residents, the neighborhood, having affordable options for everyone, no matter what their care needs were. Also, making sure that Detroit continued to grow as a leader in senior services, creating jobs, development, reducing crime, all of those things that we all want to do when we bring services to the city. So the plan A was this affordable independent living and life care community at Brush Park neighborhood. It was going to be an affordable assisted living, a community cafe, and a nursing center. So that was a great first plan. So then what happens is the plans change. And so it turned out that there was better funding through the Community Foundation of Southeast Michigan if you looked at the riverfront. It also turned out that United Methodist Retirement Homes obtained a grant for an affordable assisted living pilot. And this is actually assisted living services or 24-hour services through a Section 8 type voucher for low income. And the other thing that we realized is that in the city of Detroit, nursing home beds were not something that were easily obtained. There's a lot of nursing homes, albeit them not great nursing homes, but there are a lot of nursing home beds already in the city. So like most plans, we then had to refocus and decide what was next. So hence Plan B. So we decided that we still wanted to be part of an affordable assisted living project. So we partnered with United Methodist Retirement Centers, UMRC. And part of PVM's history is a lot of partnerships with Detroit area agencies and Lutheran Social Services and church groups and community groups. So this was not something that was out of our realm for working with another large organization. And that was going to help us address the needs for other affordable options. But we still wanted the plan to be innovative. How is it going to be different from what everyone else is doing? So we formed a joint advocacy for an affordable assisted living It was going to strengthen the nonprofit role still in the city of Detroit. We then had some shared risk and reward because we had another very secure organization that was going to be part of what we were doing. And it was also an interfaith collaboration, both with Presbyterian and with the United Methodists. So this is the start of the Thome Rivertown, this building that's on the city of Detroit. And one of the things that I can say is definitely challenging if you're gonna take on a big project is finding an old empty building in a city and deciding to renovate it versus tearing everything down. But that was our challenge, is we wanted to keep some of the history of the city. So the building that you're looking at, the large rectangular portion, was the first portion we tackled, and that became both the PACE Center. Presbyterian Villages of Michigan is part owner of the PACE Southeast Michigan, along with Henry Ford Health Systems, and so we built a full PACE Day Center in the longer rectangular part of the longer rectangular building, and in that building is doctors and therapists and social workers, a full PACE center. And so folks from all over the area, many of which were coming from nursing homes. People that PACE would go and pick them up in the nursing home and bring them to the day center. So also in that building is Henry Ford Health Systems pharmacy, and that pharmacy services the PACE Center. It also services what is in the rest of that long rectangular building, which is the affordable assisted living. And that is 4 floors of independent living with services. There is a home health care company that offices out of the building that provides home health services to the residents that live there. And because the majority of those residents are part of this affordable assisted living pilot, this Section 8 pilot, they are able to receive those services at a much reduced cost. And so they're full apartments. They have kitchens. They have the ones you see kind of on the back of the building actually have beautiful river views of Detroit. And many of those residents are paying $500 and $600 a month for their apartments. So we were really able to bring services to folks who hadn't had that type of a life before. The little square that you see that's attached to that building will eventually become the Weinberg Green Houses. So this was our first plan for developing our CCRC in Detroit. So you see that same rectangular building with the greenhouses off to the side, and then the building adjacent to it with the kind of white roof, that is our HUD 202 independent living apartments. And so Presbyterian Villages runs the apartments. UMRC runs the affordable assisted living. PACE has their day center. There is also the pharmacy, and then there's also Morrison's Dining Services has a full kitchen, and they service both the UMRC Affordable Assisted Living as well as the PACE program. And so what that left is that little square of what will become the greenhouses. So initially, the plan was for this to be nursing, as most of the greenhouse homes are. So it's an urban concept. It's a 3-story building with a rooftop, what will be a rooftop garden. The first floor will eventually be a retail space, a cafe, some sort of retail space. And then the second and third floor were each to be individual greenhouses. And it would be sponsored by PBM. Depending on who was going to manage it at the time, it would either be UMRC or PBM. And then we had multiple funding sources: new market tax credits, community foundation, home tax credits. So lots of different options as far as our funding. And then the operating funding sources would be the elders would pay portions of their rent, Medicare, Medicaid, that dual eligible, and then also benevolence. So then as we dug further, it was going to be difficult for many reasons, mostly because nursing home beds are in shortage. It's hard to get those in Detroit, but also because we don't have a legacy home really close. So the decision was, what if we made this an actual licensed assisted living? In Michigan, it's called Home for the Aged. So that's, again, the plans changed, and we decided to build 2 greenhouse homes. Again, that same stacked model. The model itself didn't change as far as how it would look. But the homes together, 21 elders can live there, is licensed as a home for the aged. And then our funding turned out to be a loan through Capital Impact Partners, the Thome Foundation, the Weinberg Family Foundation, that is our largest funder, and then other PVM Foundation and philanthropy. And then the operating funding sources are the elders pay a portion of what we do, and then comes in our collaboration with PACE, because PACE pays for the rest of it. The Rivertown neighborhood, the entire project, has over 24 funding sources, and if we include individual philanthropy as one source, there are 24 different funders. So I think that the key to that is that it's creativity, is really looking at all the nooks and crannies of how you can fund your project. So this next picture is just some pictures of our construction for the Weinberg Green Houses. This was an old grain silo, and so it started with a lot of abatement and cleanup, and so it moved right along. There are our designers did just a beautiful job, and in this picture you can see how it came to fruition. So both of our homes look pretty much the same, although one has a beauty shop and one has an extra room for an elder. One of the pictures I like to point to is that front door. When we originally had the architects designs, this looked more like an elevator, like you would see on an office building. You would come out of an elevator and there'd be a glass door, and then you'd go into the home. And so we worked with the architects and the designers, because our thought was, just like with any other greenhouse home, this is their home and it should have a front door. And so we reworked it so that each of the homes has its own front door, its own front porch, even though you're in an urban stacked model. The rooms all have big windows, definitely has that urban feel to it. You can see from the living room that one whole side is glass, and each of the homes has an outside terrace that the elders can access. And then what is not pictured in this, because it's still being finished, is there's a rooftop garden that we will be able to, it will have a kitchen area and a pergola with tables and chairs, and then through PACE we have a grant that will have some raised bed gardens for the elders to work with. So this is how our greenhouses work, and to make it work with it still being an affordable model, we definitely had to get creative with who pays for what and who supplies what services. So if we start with PDM, so we actually manage the home. The staff, the shabazin, the guide, that is all PDM staff. We also assess the elders to make sure that they meet the Home for the Aged licensing model. So we do the assessing. We handle all the training for our staff, for the PACE staff, as it relates to the greenhouse model, and we maintain the license. So there's our portion of it. The greenhouse project, of course, is the one that held our hand through this entire process. I worked closely with Lisa in how do we make sure that this is right as far as the greenhouse model goes. We partnered with them. They consulted, trained us, provided the educator guide training, and then the ongoing support. So they're the ones who showed us how to do what we're doing. PACE refers the elder to us, and these are people who are currently living in a nursing home that don't necessarily need full nursing home care. They may not need as skilled a care as you would get in a nursing home. But because of their limitations, they can't live at home. So the elders come to us from PACE, we assess them, and then they move into the home. But during the day, the elders go right downstairs to the PACE center. And in that PACE center, they see their doctors, their therapists, their social workers, all of the clinical team that is normally associated with the PACE or with the greenhouse program. That comes to us from the PACE center. Now, those same therapists and doctors and nurses are all welcome into the home to see an elder anytime they need to, and they do come up to help us with different issues or with training or to oversee things, but they provide all of the clinical support. They also they pay a daily rate. So just like PACE does if someone is living in a nursing home, we negotiated a daily rate. So we determined for us it's $185 a day. So PACE will pay us that amount, and what we take out of that is an elder payer amount. So basically their income minus $100 for spending amounts. Now, Medicaid usually stipulates that it's less than that you leave someone. But as a team, we decided we wanted to leave the elders with a little more spending money on their end. So it's determined how much the elder can pay, and then PACE picks up the rest for that $185 a day. And then we have a stipulation in the contract, because this is all very new, to go back in 6 months and then each year to review the cost to make sure we're still able to maintain what we're doing at that same rate. But the reason we can do it this way is because PVM is not paying salaries for the clinical team. PACE handles the costs on that. And then the other piece is Henry Ford Health System, which is the pharmacy that's in the building, and they supply all of the medications for our elders. They come to us prepackaged in bubble packing. They provide consultation and training to our staff. They also provide monthly updates and audits for the MARs to make sure that licensing is in place and safety compliance is in place. And then all of this we are able to do because of a generous foundation, the Harry and Jeanette Weinberg Foundation. And they were on board with how can we take a challenge, which is providing more advanced care for someone who is with a lower income. How do we still do that in a way that is meaningful and respectful and worthy of what those folks deserve? So that's kind of how all the pieces fit together. And so my takeaway from all of that, we started with this idea back in 2007, 2008. And some of that started with our Rush Park location, and in 2000, I guess a little later than that, 2009, 2010, we decided that it was going to be at the Rivertown location. So all of this takes obviously a lot of time, but what we took from it is we found a need. We found that thing we needed, that our community needed. It wasn't that PVM just wanted to do it, but there was a need in our community for this. So we took that need and then came up with ideas and changed the ideas, and were patient with all of the funding and working with the city and all of the regulations, finding the partners that made sense in this project. For us, it was PACE and Henry Ford Health Systems and UMRC. For other groups, it might be an area agency, it might be other foundations or other organizations. We had to be flexible because the first location completely changed. We had to be flexible and obviously keep our sense of humor and look for innovation. If you were opening an independent market rate assisted living, you couldn't do it at the rates that we're looking at, and you couldn't do it the way we needed to for these folks. So trying to be creative was really the opportunity for us, and the end goal was always, how do we best serve this community and the elders that are living in it? So So that's our story. I see a question from Mary. Do the personal care aides in the greenhouse work for the PACE program? No, the personal care aides, the Shabazim, they are Presbyterian Village staff, and so they work in the home and stay pretty much in the home. Now there are aides. This is where we get creative, because PACE does have aides or certified nursing assistants that work in the day center, and there are some times when they will come into the home to assist us with something. If we have an elder who is particularly challenging, the whole team will get together and meet, and it may be decided that PACE is going to supplement some assistance, for us, and those are on a case by case. But the Shabazim themselves are PVM employees. Okay, it's the 185-day rate for the nursing care units or the independent living units. So the $185 a day for us, this is the in the greenhouse, so this is the assisted living, and they are, in each home there are 10 or 11 respectively suites, and each of those suites is, I should know the square footage off the top of my head, but they all have private baths. They have a built-in cabinet and closet with their TV, and they have their it's a twin-size bed, an extended twin-size bed, and a chair and a nightstand. And each of the rooms, like a typical PACE program, has the lift tracking that goes from the bed to the bathroom if we were to need it. The staff to participant ratio in the greenhouses. Right now, we run at, I just want to make sure I didn't miss a question. We run at 2 Shabazim per house per shift. Now, what we're looking at, though, is that we may have an opportunity to be more creative with that, because right now we're running pretty traditional shifts. But because the elders primarily go to the PACE center during the day, we probably have an opportunity to not use 2 Shabazim for the full day shift. We may be able to be more creative with that, and have a partial shift where we have 2 people helping us in the morning, helping the elders in the morning, and then maybe 1 person throughout the bulk of the day, and then maybe adding some additional help in the evening where obviously there's more activity in the home with dinner and evening activities. So we've only been open, just over a month, 6 weeks, and so we're still figuring out a lot of ways we can be more creative with our staffing, because that certainly is the most challenging part, is to make sure that we've got enough people to help our elders and provide what they need. We still want to get the SAGE program going, so that and the way we're located on the Rivertown campus, it would make a lot of sense for our independent living apartments, the 202, the HUD program, that there are most certainly folks there that want to participate in our SAGE program, and really making a community, making sure that everybody's involved with what we're doing. Any other questions out there? Oh, it is not a skilled nursing facility. It is a, in Michigan they call it Home for the Aged. It's assisted living. So it is not a skilled program. In Detroit, it just was not going to make sense to, we couldn't really obtain nursing home beds. There's only a certain number that you can get in Michigan, as well as we didn't have a legacy building close by to necessarily support us the way we wanted to. So an assisted living, and it is confusing because we have the greenhouses, which is a licensed assisted living. It's licensed Home for the Aged. And then we have the United Methodist affordable assisted living program, which is truly more like an independent living with services. So it gets a little confusing on the campus, and we're actually working at really having some better identifiers so that each of the programs is a little more clear. But the greenhouse homes themselves are not skilled. It's licensed home for the aged.
I think that goes along with what Lori was saying earlier about being able to get the services provided within your own home. And so those homes are considered the homes of those elders living there. Even though they may be nursing home qualified, they are receiving PACE services and are within the homes.
Absolutely. So we very much consider this is just, this is home for them. It might not be a house, but it's most certainly home. And I can say this is probably in my 20-some-year career, this is probably the hardest project I've ever worked on. But it is also hands down the most rewarding. The thing I am proudest of in my career is that we've been able to do this for people that these options didn't exist before, and finding ways to do it has been pretty exciting.
Well, thank you very much, both Lori and Ellen, and that was very informative, and talk about the level of partnerships happening. That's incredible, even just for funding. Very interesting. And somebody just asked, how long did it take from idea to fruition? And I think, Ellen, you had said it started back in 2007 thinking about this, right?
I think from kind of idea to being done was a good 10 years. To get there. Goodness gracious. Now that said, we started, like, for the greenhouses, we started that, gosh, what, about a year and a half ago to actually
around 2 years.
Start construction.
Yeah.
So something about right along there.
Mm-hmm.
But also anybody who has questions, I'm sure Lisa can provide you guys with my email. I'm happy at any point to answer any other questions or talk to anybody if you want to know more about how we did it, because there are probably certainly more people on my end that can answer those questions better than I can, but certainly willing to help out.
All right. So thank you very much. And I think the next two webinars will be very interesting to folks who are looking for financing opportunities. We will have Kelly from Capital Impact Partners speaking to what kind of financing innovations there are through Capital Impact Partners. And that webinar will be held on Tuesday, April 25th at an earlier time, which is 1 o'clock. And then another important webinar is the value of short-term rehab in a greenhouse home. And it'll be the team at John Knox Village, Florida. They just opened up middle last year, and they are doing a phenomenal job. And so they'll be on sharing their experiences and being available to answer questions. And that webinar will take place on Thursday, May 11th, again at 1 p.m. So again, thank you so much for staying with us and listening to the innovations that are coming from the Greenhouse Project. And if any of you have any further questions, please reach out to Rachel, and she can forward them to the people who need to know. Thank you so much, and have a great day.